I'd like to begin by just explaining what this bill does. By pausing the income thresholds, what it does is it means that more people will be punished for not taking out private health insurance through an increase in the Medicare levy, and less people will qualify for the private health insurance rebate. It's pretty straightforward. You pause the income thresholds, inflation, bracket creep, less people qualify for the rebate and more people will be pushed into the higher income bracket, which means that they will be charged an additional Medicare levy. Now, let me say that when we look at the impact on the private health insurance rebate, the Greens believe that's a good thing. There will be a saving of $600 million over the next 4 years as a result of fewer people qualifying for the private health insurance rebate. But when it comes to the additional Medicare levy linked to private health insurance cover, we don't think that's a good thing. And let me explain my reasoning on that issue. Private health insurance should be a choice. It should be a choice. It's not the role of government to create incentives and penalties when it comes to whether people take out private health insurance. It should be a choice for them. It should not be a government policy. I think we forget the history here of how we got to this point and how we've got to a point where we now spend $5 billion of public money on subsidising people who take out private health insurance. It's interesting, isn't it, that we're having a lot of discussion about free trade, a historic free trade agreement with China, another touted for India. And yet here we've got one of the biggest subsidies paid by the government to an industry that's providing very little benefit when it comes to the alternative of where that money could be spent. A $5 billion subsidy to the private health insurance industry, an industry that can set its fees, knowing that every time it increases its premiums, it's the taxpayer that underwrites a third of that increase in cost. What a great business. What a terrific business. Every time I increase the cost of my product, I know the government will be paying 1/3 of that increase in cost. Terrific business if you can get it. Let's have a little history lesson here. This was introduced by the Howard government. At the time, I remember the Labor opposition, I think it was Jenny Macklin, who suggested that this was one of the greatest public policy disasters in her memory. It was, by many people on the Labor side, indicated that they believed this was a serious mistake. And yet, here we are, years on. John Howard introduces the notion of a rebate and a system of disincentives under the guise of, and I quote, taking the pressure off our public hospital system. So we had a big debate. Hospital waiting lists, we know it, we've had the debate for decades. Hospital waiting lists, emergency departments, health system under strain. Sound familiar? We're there again. But at the time, the solution from the Howard government was we need to increase uptake of private health insurance. That is the solution to the health crisis that we're facing, to the increases in waiting lists, to the times that people have to spend in emergency departments. And he introduced a system of measures. The first was lifetime health cover. So lifetime health cover, basically, the longer you wait to take out your private health insurance, the more you're going to have to pay for it down the track. That was followed by an introduction to the rebate, the 30% private health insurance rebate. When you look at, it's true, those measures did increase uptake of private health insurance. But when you look at what the main driver for the increase in uptake of private health insurance, it wasn't the rebate, it was lifetime health cover. You only need to look at the graphs which chart the increase in private health insurance uptake to know that it was lifetime health cover that was the driver. And the rebate was a little bonus to those people who had already decided they were going to take up private health insurance. Now here we are, decades down the track, having the same debate that was the genesis for the $5 billion subsidy to the private health insurance industry, and nothing's changed. People are still waiting in emergency departments. Waiting lists for elective surgery continue to blow out. Where were the purported benefits of this $5 billion subsidy to the private health insurance? They haven't materialised. They haven't materialised. And why? Well, there are a number of good reasons for it. The first is that a lot of people just don't use their cover when they need it. People who end up in emergency departments and then having surgery in public hospitals who have got private health insurance, they don't use it. So the taxpayer is paying a third of their premium for a product that they don't use. Makes no sense. Makes absolutely no sense. We know that having an insurer, a public insurer like Medicare, allows us to keep prices down. Private health insurance can't compete because it doesn't have the monopoly that Medicare has over what it's prepared to pay for medical services and devices. That's one of the great things about Medicare. We've got a monopoly insurer that can set a price. Private health insurers don't do that. It's the doctors in the system who can set the prices for the services that they charge. So when you put that together, when you put together the fact that people don't use it, that many of the things that we're paying for through private health insurance cover, like some of the extras, the gym memberships, the opportunity for people to see complementary health practitioners and so on, I mean, it's no wonder that what we've ended up with is a situation where we're spending $5 billion and not getting a return for that money. Now, you don't have to take my word for it. Any health economist worth their salt will tell you that if you want to talk about fixing the health system, you've got to start with this massive public subsidy to the private health insurance rebate. We had the health economist Terence Cheng at Melbourne University, who did a study of this and said, basically, if you put the $5 billion that we've now got going into the private health, you invested that into the public health system, you get a dividend of about 2.5. So let me give you an example. Here we've got Dr. Cheng, who says that if you reduce the subsidy, you would generate a huge reduction for the taxpayer. So the direct savings from reducing the subsidy, let's say by 10% in his words, which is $359 million, if you needed to recoup that, well, you needed to spend that money directly on the health system through our public hospital system, you'd spend $144 million. So instead of spending $359 million subsidising private health insurance, you could spend $144 million directly through our public hospitals. So that, on the whole, savings from reducing spending on rebates outweigh the predicted increase in public hospital costs by a factor of 2.5. So we're blowing good money after bad. And there are a number of health economists who have done the same analysis. It makes sense when you understand the way the health system works, when you understand the monopoly that Medicare has as an insurer over the cost of services. It makes sense when you understand that a lot of people don't use their cover, and then when they use their cover, they're using it on a range of other benefits that don't add much value in terms of the health system. Now, if private health insurance was an appropriate vehicle through which to get good value for money and fairness, I'd be all for it. I don't have an ideological view that says we should or shouldn't spend money on private health insurance. I just think we want to get value for money out of it. And we're not. We're not. We had John Howard, over a decade ago, tell us that the reason to introduce this policy was because we had a public health system under strain and we needed to spend the $5 billion of public money on private health insurance to increase private health insurance uptake to fix the system, and we're having the same debate right now, here and now. And in fact, what we're doing with this policy is we're going in the opposite direction, which is why the Greens will support this bill. And it's not just value for money. It's not just an issue of value for money, it's an issue of fairness. It's an issue. Why should every taxpayer in the country have to subsidise those people who take out private health insurance? Why should somebody who makes a decision based on their level of income not to take out private health insurance contribute to the private health insurance cover of someone who does? And we know, when we look at people who take out private health insurance cover, the data is very clear. People who take cover, on average, are much wealthier than those who don't. So we've also got this massive redistribution of wealth. We've got wealth being funnelled away from people on low incomes to people on high incomes to pay for a third the cost of their premium. With what? What benefit do we get? We don't get one. We don't get one. If that money was spent directly in the public health system, we would get a dividend of 2.5. For every additional $10 that we spend on private health insurance, we get $25 worth of value out of the public system. So what we've got is we've got ourselves caught up in this idea that increasing private health insurance cover, that is more people taking out private health insurance, is a de facto indicator of a health system that's functioning well. Well, it's not. It's not. Private health insurance should be a choice. Anybody who wants to take out private health insurance cover should be afforded that choice. But it's not the role of government. It is not the role of government to create a system of incentives and penalties to allow that to happen, because we don't get this value that we get if that money is spent directly in the public system. Now, what's worse is we're now on a path that's taking us towards not just allowing private health insurance cover to cover services delivered in a hospital, but we're now seeing the rollout of trials that would allow people to use their private health insurance cover to cover services delivered in primary care, that is, when you go and see a GP. Now, if you've got private health insurance cover, that might sound like a good thing. If you don't, well, you're basically part of that 50% of Australians who will be disadvantaged because of the implementation of a two-tiered American-style health system, where you get one level of care if you can afford it and another level of care if you can't. So, in closing, Mr. Deputy President, if we want to make use of the private sector in health, then we should be engaging our private hospitals, and there are many of them, directly. We shouldn't use private health insurance as the vehicle for doing that. A government could easily contract a number of services through private hospitals. In fact, it does in many instances, and that's the best way of guaranteeing value for money. But to embark on a course when we're having a debate about the sustainability of the health system that says the way to fix the problem is with the solution that failed 10 years ago, well, that's a mistake. It's ludicrous. It's nonsense thinking. What we should be doing is looking at the $5 billion we now spend subsidising private health insurance cover for those people who decide to take it out, and we should recognise that rather than spending our money in an area that fails both the fairness and value for money proposition, that money should be redirected directly into the public health system, into our public hospitals, and we know that for that $5 billion we can get $10 billion of value. That's the proposition that faces us. It's a proposition that's backed by research. So we're going to have a meaningful debate here. Let's not talk about freezing income thresholds. Let's be a little bolder, let's be a little more ambitious, and let's start talking about the sort of value for money we're getting out of this huge subsidy to the private health insurance industry, who knows that every time they decide to put up their premiums, every sucker in this place is going to be paying for it. Every person in the country will be underwriting the increased cost of that premium. What a great business that is to be in. Increase your costs and charges, and know that the taxpayer is going to be footing a third of the bill. Good work if you can get it. Good work if you can get it. We've got a big choice in this country, a big choice. The choice now is, are we going to tackle the question of what a sustainable and fair health system looks like? If we're going to do that, we've got to take on this inequitable, this inefficient, this unfair subsidy that delivers very poor value for money for the Australian consumer.